Hi, John Daly. I'm Parker. I'm going to be your nurse today. And I just wanted to take a little bit of time to go over what you might expect going through chemotherapy, and also some of the side effects that you might experience and how we can work on those together. Chemotherapy targets cancer cells, especially those that grow and divide quickly, but that also means that it could affect healthy cells in your body that grow quickly too. And being that can affect healthy cells, this is why side effects happen. But don't worry too much about that because there's going to be some strategies and medications that we can use to help you get through them. The first one I want to focus on is nausea and vomiting. Some chemo drugs are more likely to cause this than others, but to help, we'll give you some anti-nausea medications before and after your treatment. And you might also find it helpful to eat small and frequent meals rather than large meals. Also try to avoid strong smelling cooking odors and perfumes or smoke because this can trigger nausea. The second thing I want to focus on is fatigue and your low blood cell counts. Fatigue is quite common with chemo, and this isn't just being tired, but it could be a whole body exhaustion. This can happen because chemo affects your bone marrow, which is used to produce red and white blood cells. And fewer red blood cells can cause anemia, which may make you feel weak and out of breath. The next thing I want to focus on is hair loss. Hair loss can be a more emotional side effect for some people, and not all chemo causes it, but if yours does, you may notice hair thinning or complete loss within a couple of weeks. The good news is, most of the time this is temporary and your hair will grow back. But sometimes it could be with a new texture or color. And the next one I'd like to discuss is just safety. Chemo medications can stay in your body fluids for a couple of days, so it's pretty important to wash your hands thoroughly after using the bathroom. And if someone else is helping you clean up vomit or spills, they should ensure that they're wearing gloves. And the last thing I'd like to discuss is, I just know that this can be overwhelming, but you're not going through this alone. We're here to walk you through this every step of the way. And if you are feeling overwhelmed, keep a journal of how you're feeling, any side effects that you notice, and bring any concerns that you have to us right away. There's no such thing as a dumb question when it comes to your health, so just feel open to ask any questions you want. I just want you to know you're strong, and every treatment is a step forward in the right direction. And if you have any questions or worries, just let me know.